Can both of you give like a really brief observation of what's changed with you since you've been taking it as far as it goes with health?
Well, for me, I've noticed that it actually made me feel I'm not as anxious, especially like with the lockdowns and all that. I'm sleeping better. So I'm sleeping the whole night through with the actual CBD oil that has melatonin in it. And I have energy in the morning, and I think it's just an overall smooth, like I feel, I don't feel anxious, in other words, because I was getting stressed out. So I'm not as stressed anymore. And I know Martha's felt, because me and Martha had talked about it, we both have felt that our moods, you know, like we would react a certain way, and we're not reacting that way anymore.
What do you mean you acted in a, like in a stressful situation, you acted in like a hostile or meek behavior, and now it's more neutral?
Yes,
Well,
I'm
not-
more calm, more
Yeah.
calm. You think about your reaction instead of acting in a bad situation. You just calm yourself down and try to smooth out the situation so you can continue on a nice way.
So from what I'm gathering with that response, Dr. Phillip, does it help with brain fog, to clear up brain fog so that they get more mental clarity?
It may, but I think that's probably more hormonal than specifically the endocannabinoid system or CBD related.
Okay.
So once you use this, excuse me, once you use the CBD oil, everything should kind of balance out, or like the way you're saying, not really, because it's also hormonal.
So if the issue is more the endocannabinoid system or the CBD related system, then yes, things should kind of level out or neutralize or improve, whatever words you want to use. If it's hormonal, it may affect a little bit, but it may not get the maximum improvement.
Okay, thank you.
But in the past, I've heard Christopher talk about different foods that you can eat in order to help with modulating estrogen levels and progesterone levels and thyroid.
Do we have any other questions?
I'm good, Chris. Thank you,
Okay.
Dr. Phil. This has been very helpful.
You're very welcome. I'm glad I can help you out.
Okay, if there's no other questions, I guess we can call this a wrap for tonight.
Well, thank you all for having me, and thank you for the questions. And Jovi, whenever you want to have me back, I'd be more than happy to help out.
And I'm totally grateful. Thank you so much for your help, because this has been helping me out a lot.
Very
It
good.
has been helping me too. So thank you very much, Dr. Phil, and you
You're
have a
welcome.
nice holiday. Thank you.
You too. Try to enjoy your family the best you can in Chicago.
We're trying. We're trying.
Right.
Sorry.
And thank you, Dr. Phil, for the information. That helped me out too.
Oh, you're very welcome, Alice.
Thank you, doctor.
You're welcome, Rita.
Yeah, thank you. You answered my questions today.
Thank you. Thank you. You're welcome.
Okay, then I'm going to sign off. And thanks for coming on, Dr. Phillip, and answering all the questions and helping people with outside CBD oil, helping them with some of their concerns with their health as well. Thank you.
Absolutely. You're welcome.
Thank you.
Thank you. Good night to all.
Have a
Bye-bye.
good night.
Good night.
Can I
Good
say one
night,
thing?
everybody. Yes.
What's-
Rita wants to say,
What happened, Rita?
pardon me?
Oh, I thought you were saying something.
Oh, I asked if I could say one thing.
Yes.
Last week, when Christopher was asking me what I attributed my improvement to, I left out the most important thing. Clean eating and following a keto diet. And I also said that I had gained some weight, and I seem to have lost it in the past 2 weeks.
Oh, that's awesome.
Yeah,
Awesome.
yeah. So that's it. That's all I had to say.
When you do eat clean, you don't eat as much food and the calories are less than the junk food. So yeah, the weight should come up to follow suit. And it's not going to happen overnight. Like I say, consistently, your body wants to stay where it is. If it's at 140 pounds, it wants to stay at 140 pounds. So it might take a couple of weeks, might take a couple of months. For me, personally, sometimes if I'm trying to lose weight, my weight won't budge for a month or two. And then all of a sudden, it like drops 5 pounds in one day. So everybody is different. So just stay the course and say, don't think that it's not working. Give yourself all the tests that they do with research, they do for 12 weeks. And the reason behind that is because your body has to adapt to whatever the change is. So keep whatever you're doing, keep doing it for about 3 months and then decide if it's working or not. Cool. All right. Well, I'm going to sign off and get some stuff done before I go to bed. So everybody, if I don't speak to you, if I don't see you on Sunday, have a great Thanksgiving.
You too.
Happy Thanksgiving.
Thank you.
Happy Thanksgiving. Okay, good night, Chris. We'll see you on
Bye.
Sunday at 1 o'clock Sunday.
1 o'clock.
Yay!
I just hear the excitement coming from Josie.
I knew that. Good night, everybody.
Good night.
Bye.
Good night, everyone.